Welcome to the 2020-2021 Annual Report, Building Up Accreditation, Improving Public Health in North Carolina. This year, as our health department staff superheroes across North Carolina continuously rallied together to test, track, and vaccinate our communities against COVID-19, the North Carolina Local Health Department Accreditation Program took some time under construction so that we can strategically move forward and support the North Carolina public health system in years to come. Site visits continued to be on hold due to North Carolina Governor Executive Orders 119 and 193, which allowed our board to grant 2 12-month extensions for accredited health departments. Even though we were not conducting regular site visits, accreditation staff, board members, AACs, and partners were as busy as ever performing their duties and improving the program before site visits are scheduled to resume in fall of 2022. The program and board took time to pause and think strategically about how to revise accreditation, which began over 15 years ago. We conducted the program's first strategic planning process, which resulted in the strategic roadmap for 2021 to 2025, which was released in April of this year. This includes a refreshed mission, vision, and values for our program. Our updated mission is to support North Carolina local health departments in innovating and advancing public health through accreditation. Our vision: that all North Carolina local health departments utilize the accreditation process to continually build their capacity to equitably respond to the unique health needs of their communities. Our work is supported by core values of quality, partnership, equity, adaptability, reliability, transparency, and efficiency. The roadmap also details 5 priorities, which will inform program work plans for the next 4 years: evolving standards, benchmarks, and activities, streamlining the program, building quality improvement structures, leading efforts to improve diversity, equity, and inclusion, and intentionally engaging partners in accreditation. We began working towards these priorities by forming relationships with the Public Health Accreditation Board, Population Health Improvement Partners, and others. We outlined measures and next steps for 2021 through 2022 in a full strategic work plan to transparently communicate our path forward. Meanwhile, the Standards Work Group completed the first phase of the program's large-scale participatory process to review all 147 activities and interpretation guidance. The first phase, to make programmatic changes, is reflected in the 2022 HDSAI interpretation document, version 7.0, that was released in March of 2021. This document goes into effect January 1, 2022, and considers many components from the strategic roadmap. These revisions were informed by a public comment period in November 2020, where our program heard 803 written comments. The program clarified text throughout and made documentation requirement changes to 19 activities based on these public comments. As part of this update, the program integrated the revised 10 essential public health services into each accreditation activity. The document also received a facelift overall, integrating an updated accreditation color scheme and design. Additionally, the accreditation program produced communication materials for accreditation team members to use with their health department staff. Why Accreditation Matters materials are now available for each stage of accreditation to help get the health department ready to launch. Even though accreditation and the world around us look different and pose challenges this year, we all found ways to pivot and continue existing work. Health departments worked tirelessly, meeting accreditation activities as they responded to COVID-19, as documented in the COVID-19 Response Guide. The accreditation program continued providing trainings and resources, adapting all materials for virtual delivery. AACs from across the state zoomed in for monthly webinars to hear updates, receive resources, and share input with the program. Each year, we conduct an annual survey to get feedback from local health departments. We use the information from the survey to inform ongoing quality improvement efforts. This year, we created interactive slides to see annual survey results across years. And in 2021, we incorporated strategic planning questions to measure baselines for each priority. We needed many hands on deck to accomplish this year's ambitious projects. In 2020 through 2021, more of our annual budget was able to support people and projects as we did not have many site visit expenses. The accreditation program expanded its staff to welcome Margaret Benson-Nimitz as the Strategic Approaches Coordinator and 2 public health graduate students, Allie Zerker and Michaela Carrington, to execute this work. This year's strategizing, rethinking, and retooling were all done under the advisement of many public health professionals across the state, including the Accreditation Board, the Accreditation Standards Work Group, and the Agency Accreditation Coordinator Advisory Council. While these individuals were involved in COVID-19 responses in their day-to-day roles, they also assisted the accreditation program in its response. They demonstrated a great deal of passion and commitment for protecting and promoting the health of everyone in our state. The board operated fully remotely in 2020 through 2021, completing their regularly scheduled meetings in addition to special meetings in response to COVID-19, strategic planning, and health department adjudication. Moving forward, the board has agreed to meet quarterly, with strategic planning as a standing agenda item. Rebecca McLeod ended her board member term with us this year. We thank Rebecca for her many contributions to public health and the accreditation board. We also welcomed 3 new board members this year: Dr. Rhonda Stevens, Commissioner Fleming Elamine, and Health Director John Rouse. Thank you to all of our board members for stepping up to serve our state through leadership. The AAC Advisory Council met quarterly on Zoom to help shape the HDSAI interpretation document revision and strategic planning process. Thank you to our fabulous regional AAC representatives for taking the time to create a stronger program for local health departments. This year, more than ever, the accreditation program expanded from its consistent structure to think bigger and more broadly about how to advance the program to match the field's current needs. We are committed to adapting the program with intention, input, and clear communication. As we do so, we thank all health department superheroes across our state who are not only protecting our communities each and every day, but also are providing ongoing feedback so that the accreditation program can reach new heights. Together, we are innovating and advancing public health across North Carolina.